Straumann presenta PerioMX, el primer programa de odontoperiodismo clínico de América Latina.
Amigos de PerioMX, muy contentos estamos todos el día de hoy aquí en la MP en Querétaro con el Dr. Schwarz. Thank you very much, Sam.
A pleasure.
So, aquí estamos en el stand de Straumann y vamos a tener una breve charla con el Dr. Frank acerca de tópicos importantes. First of all, thank you very much, Frank. We read a lot about you. So, well, we are listening to you for all your lectures about periimplantitis or periimplant disease. Well, the first question is, what happened with periimplantitis disease? It could be a cure for this kind of disease?
So this is really important. What has really changed over the past years is the awareness that we have no clue and no specific treatment procedures on how to manage periimplantitis. So we have to spend a lot of money, a lot of time in order to end up with some not always promising results.
Okay.
And now what has changed is the awareness that mucositis precedes periimplantitis and that we have a good chance to control the problem at a very, very early stage.
Yeah.
By early diagnosing periimplant mucositis and managing mucositis. That's the clue.
That's the clue. So we can redefine this kind of disease because this disease is a new disease for this century. So can we take a part of pathogenesis of periodontal disease like a pathogenesis for periimplantitis disease? It could be the same, or what is the challenge for this kind of?
So basically periodontal diseases and periimplant diseases have many features in common. So it's the host interaction on how the body reacts towards a biofilm that formed at the tooth or an implant. So this is basically the same. But we have clear differences in terms of the progression, in terms of the specific pattern of defects that form around implants and teeth. And therefore, we cannot really compare periodontitis with periimplantitis and not really gingivitis with mucositis. There are specific disease entities.
Okay, so well, gingivitis is before periodontitis, but gingivitis could be at entire life for the people. So mucositis has a short term. For what happened, because it could be possible that there could be any kind of changes in the cells for the periimplant mucosa. What happened?
Yeah. So what really happens is the presence, the formation of the biofilm. So this is the true etiological factor. So without the biofilm, you may not end up in periimplant diseases. So this is for sure. But we have some factors that increase the probability of the disease occurring. So for instance, smoking is a factor, history of periodontal disease. But without biofilm, you may not end up in mucositis.
So we saw in your lecture that like in a periodontal pocket, we treat the cementum surface in a periodontal pocket, but in the periimplant pocket, you are treating like a perimplantoplasty. What do you think about it? It could be a good reference, the perimplantoplasty for the treatment for this kind of problem?
Yeah, for specific defects, for specific cases, such a procedure may be helpful, but it's rather complex. We have non-surgical treatments that should always be applied first, and surgical interventions according to specific local and also systemic factors may improve the outcome of treatment.
Okay.
But in general, it's a rather complex area, and it's not that simple as treating periodontal diseases.
It's not the same. So we make this kind of interaction with like a game. So we are going to point an image or like a picture, and we want to know what's your opinion about it.
Okay.
So, well, first of all, about peri-implant mucosa. What is your opinion about peri-implant mucosa and keratinized tissue?
Yeah, so that's a typical case. So the misplacement of an implant results in the compromisation of the soft tissue as well. Yeah, so this is not a good starting point for a crown.
Yeah, so it's very important to know what is the biology for this kind of tissues.
Exactly. So this implant needs to be removed. There is no matter of discussion.
Yeah, there's no more discussion.
Yeah.
And this kind of image, you were talking about the roughness of the surface for the implant.
Exactly.
Is it possible that it could be the surface or ideal surface for the treatment for the peri-implant disease, or not? Like, if we can think about reosseintegration, avoid for this kind of implant surface or any kind of surface?
Yeah, so I guess we will have to consider the balance. So the balance is a smooth surface is less attractive for plaque, but a smooth surface is associated with long healing periods, osseointegration periods. So the way back to machine surfaces may not really be helpful. So it would put us back in implant dentistry for about 25 years. So this may not be the clue. And we also know that it's difficult to remove the biofilm from a structured surface, but once we have removed the biofilm, the structured surface helps us to re-establish new bone to implant contact. So it's the balance. It's something between black and white.
Yeah. So what about this kind of tools for hygiene?
Really important.
Chemical therapy versus, I think, brushing techniques or physical therapies. What about your opinion?
So
chemical versus physical.
Yeah. So basically, the recent EFP workshop has addressed a systematic review by Professor Gianni Salvi. He addressed home care plaque measures, controlled.
Yeah.
So mechanical and, of course, mouth washes, mouth rinses as adjunctive tools. And so far, the patient is advised to use these tools, but again, we cannot recommend any specific tool. So mechanical plaque control, home care plaque control is the fundamental basis.
What is the basis?
Yeah.
So this is personal. Power toothbrush versus manual toothbrush. What is your opinion?
It's the same. It's the same. We cannot identify any superiority in using rotating brushes according to the available literature. As long as you use a brush, you're on the safe side, because we have to be honest. Many patients, they completely missed the basic awareness that you also have to clean implants.
Yeah. So what about? So we are seeing a lot of pictures about you, like proving, like we have a sounding or pre-implant sounding. What is your opinion about this kind of plastic soundings?
Yeah. So there is no need to use plastic probes to probe implants. You can use conventional periodontal probes at the implant site as well.
What important?
Yeah, this is really important. As long as you use a probe, everything is fine. And we don't have any data that you may damage the surface by using a conventional probe.
Is it a myth that the conventional probe could damage the implant surface?
The surface? No. This is just no data. So this is pure speculation. Pure speculation. Yeah.
Well, this answer is very important for us. So BMPs for implant regeneration, is it the future or it could be possible? What is your opinion about it?
Yeah, so BMPs have always been promising biologics for bone regeneration in general, but at this moment when we are talking about BMPs, when you ask me the question, we don't have a single clinical data on the BMP application at peri-implantitis sites. And therefore, it may not be an agent to overcome the infection, but it may be an agent to build up the bone.
that's maybe the future.
But preclinical data, our own group has performed preclinical research on BMPs, BMP2 for instance, so it has a potential.
The potential. For the next, Latin America,
Yeah.
the place that we live. What is your opinion about Latin America? Because Europe is in another era for implants or for rehabilitations. So the data that you exposed is for Europe. But what is your opinion about Latin America? If we live in another world, what happens with Latin America? Well, I don't know if you know that in Latin America we had a consistent epidemiology of peri-implant disease. So about this, what could be the message for the people in Latin America, for the clinicians in Latin America?
Yeah. So the message is of course the basic etiology and the basic pathogenesis of peri-implant diseases, and it also refers to periodontal diseases, is independent from ethnic groups. So once you miss to brush your implants, you may run into the same trouble either when you live in Europe or when you live in Peru. So it doesn't matter. But what really may vary may be a specific incidence or prevalence in different regions that may be influenced by some behavioral factors, that may be influenced by the specific types of implants that are being placed. So there may be some differences, but the basic mission to manage peri-implant diseases, as we discussed today, is applicable from Canada down to Australia and New Zealand.
Yeah, thank you. So the last question, Mexico. A message for the students from Mexico, for periodontists and implantology, because there's a lot of people that follow you. So what could be the message for the people that study in Mexico, well, around the world, but for the people that are starting this way?
Yeah. So the basic message is, in order to become a good clinician, you need a certain experience in science.
Yeah.
So without knowing how cells interact, how bone forms, how soft tissue relates to bone formation, you will never be able to understand some clinical outcomes that happen in your patients. And therefore, my clear advice is to go back to universities to start some basic research, at least for a certain period of time. And as far as I see my activities as associate editor and reviewer for so many journals, there are more and more high-quality papers coming up from Mexican groups. And I'm more than impressed on the quality and the scientific level of this country, and therefore I would highly encourage you to proceed and to follow this track.
So with Frank, thank you very much for the time.
Yeah.
I know that you are a very busy person, but your concepts and your answers are very important for us. So thank you very much and good luck and every success for the world. Thank you very much.
It's my great pleasure.
Bueno, pues damos las gracias a Frank Schwarz, que estuvo con nosotros aquí en PerioMX. Espérenlo próximamente en Inteligencia Dental, gracias a Straumann México y ahora al Becrest. Hasta la próxima. Thank you very much.